Are there options when it comes to full teeth replacement with dental implants? Hi, I'm Dr. Adrian, and when you look at the options for replacing teeth with dental implants, it is often dependent on how the patient presents and the condition of their mouth. This is very complex treatment, and for every case there must be a lot of planning before we start doing treatment. One of the biggest considerations is actually the amount of gum we see and the amount of bone that's there before we do treatment. We often talk about traditional all-on-4 treatment or all-on-X treatment, where the bridge replaces the teeth but also replaces gum and bone. And usually when we're doing this treatment, there is missing teeth, there's usually gum disease, and the patient has already lost a lot of gum and bone. So when we're using this bridge, we've got the option of actually replacing the teeth plus the gum and bone with the new teeth. In those patients though that are very gummy, where when they smile, they might show a big smile and not only show teeth, but show a lot of gum and bone, to hide this transition line would be very difficult. We have to actually end this transition line at least 5 millimeters above the highest point of where the lip moves up and shows the gum and bone. And if we were to do this in Gummy Smile patients, it would mean removal of a lot of bone and a lot of gum. Although this is simpler treatment when we remove gum and bone to create space, or we've already lost a lot of gum and bone because of gum disease or gum recession, this is very simple treatment because it enables us then to just complete this as part of the prosthetic bridge. In what we call an FP1 scenario, this is when we only replace the teeth, and this is very unique. It's a much harder and more complicated surgery to do, because instead of removing the gum and bone, you're placing the implants at the position where the teeth would come out. And it's very complex because we know over time there may be some shrinkage. We really have to plan this case very carefully, and it usually involves more implants because when we're only having teeth, we need to have even placement of the implants. So usually we're looking at a minimum of 6 implants to do this. When we're doing this case, we will usually end with the bridge on the day of surgery, and that's because we need the teeth to support the tissue immediately after surgery so that we don't get any shrinkage or any collapse of the gum tissue. So when you're considering doing all-on treatment, the most important thing is communication with your surgeon and dentist. It's very important for them to discuss the different scenarios when it comes to actually doing the case. It's also very important for them to do a lot of diagnostic planning of where the implants are going to go, what your final smile is going to look like, and of course encourage a lot of communication so that they can ask about the design of the teeth, the shade of the teeth, and what you would like with your smile. This has been quite a long video, and I hope it's given you some information on the complexities of doing full teeth replacement with dental implants, considering the different types of bridges, and also to ensure that as a patient you understand that this treatment, as complex as it is, can be planned very carefully so that the end result is always the best that we can possibly achieve. If you have any questions, please leave them in the comments below. I look forward to one day seeing you in the practice.